What is non-alcoholic fatty liver disease? What is non-alcoholic fatty liver disease? Non-alcoholic fatty liver disease, NAFLD, is a condition where fat builds up in the liver. Though it often affects adults, it's becoming more common in children. About 1 in 10 children in the US have NAFLD today. There are 2 types of non-alcoholic fatty liver diseases that affect children. Non-alcoholic fatty liver, NAFL. Non-alcoholic steatohepatitis, NASH. NAFL is a mild form of NAFLD that presents with abnormal blood tests or ultrasound finding in early stages of the disease. NASH presents later, is more severe, and can lead to permanent liver damage, such as cirrhosis. It's important to diagnose NAFLD early to prevent long-term, permanent damage to the liver. What causes non-alcoholic fatty liver disease in children? Obesity is associated with most cases of NAFLD. Genetics and certain health conditions increase the risk of developing NAFLD. Conditions that are associated with NAFLD in children include obesity or being overweight, type 2 diabetes, high blood pressure, high cholesterol, metabolic syndrome. Scientists are still studying the role genes play in developing NAFLD. But according to the National Institute of Diabetes and Digestive and Kidney Diseases, genetics could explain why NAFLD is more common in certain populations. What are the symptoms of NAFLD? Often there are no signs or symptoms of NAFLD in children. Children with NASH, the more severe type that causes cirrhosis, may not even have symptoms. Potential symptoms of NAFLD may include feeling tired easily or having pain in the upper right side of the abdomen. If you suspect your child is experiencing signs of NAFLD, contact their pediatrician for information about screening. How to diagnose fatty liver disease? The only sure way to diagnose NAFLD is to order a liver biopsy. But before that, your child's doctor will take several steps to determine the likelihood of NAFLD. First, they'll ask about your family history and perform a physical exam to look for physical signs of NAFLD. These could be an enlarged liver or spleen or dark patches of skin, which could indicate insulin resistance. After the physical exam, your child's doctor may order a blood test to check for increased levels of liver enzymes. If the test shows increased levels of liver enzymes, your doctor may then order an imaging test like an ultrasound to look for signs of a problem with the liver. If your child's doctor suspects that your child could have NAFLD, they might order the liver biopsy. A very small piece of liver tissue is sent to the lab, where a pathologist will examine it closely to determine if NAFLD is present and what may be causing it that could be treatable. How to treat fatty liver disease? Currently there are no medications approved to treat NASH or NAFLD. If your child is overweight, losing some of the excess weight will help reduce the amount of fat in the liver. If your child's NASH causes cirrhosis, their doctor can recommend a treatment plan. If the cirrhosis progresses to liver failure, a liver transplant may be necessary in very rare situation. How to prevent NAFLD? You can help prevent NAFLD in your child by being a good role model. The whole family can get healthier by adopting a healthy diet and increased activity plan. Get outside and play regularly. Eat a healthy, balanced diet. Avoid fast foods and sugary drinks. Stay active. Your child's pediatrician can help you with this. Ask about creating a healthy, nutritious diet plan for your whole family. Can NAFLD be reversed? You can reduce the amount of fat in the liver by losing weight gradually and adopting a healthier lifestyle. This can help reduce the risk of NAFLD progressing to cirrhosis and liver failure. What is the diet for NAFLD 2022? Mediterranean diet has been recommended as the best dietary pattern since it is easy to follow and, independently of caloric intake, its nutritional components have beneficial metabolic effects that not only improve steatosis, but also risk factors for cardiovascular events, the leading cause of morbidity or mortality in individuals with NAFLD. Other dietary patterns such as ketogenic diet and dietary approach to stop hypertension, diet can be used in patients with NAFLD. Recently, intermittent fasting diets have gained popularity among healthy individuals and have been proposed as a safe and effective treatment for the metabolic syndrome in experimental and in a few human studies. In this narrative review, we aim to summarize the evidence for the available dietary approaches for patients with NAFLD. Most doctors will recommend the Mediterranean diet that is low in refined carbs and high in protein. It includes lean meats like fish and low-fat dairy as well. In addition, you can consume fresh produce like vegetables and fruit. These types of foods will support your liver and help to prevent NAFLD. Things you can do if you have non-alcoholic fatty liver disease, NAFLD. Early-stage NAFLD does not usually cause any harm, but it can lead to serious liver damage, including cirrhosis, if it gets worse. Having high levels of fat in your liver is also associated with an increased risk of serious health problems, such as diabetes, high blood pressure, and kidney disease. Adopting a healthy lifestyle is the main way of managing NAFLD. For example, it can help to lose weight. You should aim for a BMI of 18.5 to 24.9. Losing more than 10% of your weight can remove some fat from the liver and improve N.A.S.H if you have it. Eat a healthy diet. Try to have a balanced diet high in fruits, vegetables, protein and carbohydrates, but low in fat, sugar and salt. Eating smaller portions of food can help, too. Have water instead of sweet drinks. Exercise regularly. Aim to do at least 150 minutes of moderate intensity activity, such as walking or cycling, a week. All types of exercise can help improve NAFLD, even if you do not lose weight. Stop smoking. If you smoke, stopping can help reduce your risk of problems such as heart attacks and strokes. NAFLD is not caused by alcohol, but drinking may make it worse. It's therefore advisable to cut down or stop drinking alcohol. So take care of yourself for an overall healthy body. Thank you for watching us on Daily Health, and don't forget to subscribe.